Dr. Deuk here at the Deuk Spine Institute. Our patient today is having bilateral sacroiliac joint treatment with the Deuk plasma rhizotomy. He has severe pain in both sacroiliac joints. He injured his back at work. The injury originally was treated elsewhere with a hemilaminectomy, and then finally he came to me with horrible back pain. We performed the Deuk laser disc repair to repair L23, L34, L45, L5S1, 4 discs. He was pain-free in his spine, very happy for years, and then he developed sacroiliac joint arthritis pain from injury to the SI joint, which I believe is work-related, and he has a torn piriformis muscle, which has bothered him and it just won't go away. So we're going to fix the piriformis second, but first the SI joints. Henry, let's share with our audience how we repair the SI joints.
Of course.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. Our patient has sacroiliac joint pain, and as you saw from our video, this is typically caused from injury to the SI joint. That's through trauma. In his case, his injury was a work-related injury. Shot? All right. So what I'm trying to do, folks, I'm trying to get to the pain nerves. We call them pain nerves. It's the easy way to say it. A pain nerve is basically any nerve that transmits pain from an area of your body to your central nervous system, where you would interpret it as pain. Any questions?
Yes, we have a question coming from Steve on YouTube.
Hi, Steve. Welcome.
Asking, hi doctor, I had a right side SI fusion years ago and I'm still having excruciating pain issues that radiate down my right buttock and into both feet. They feel like they were in a vice grip. How could you help me?
Absolutely, we can help you, 100%. The first thing you need to do, my friend, is get our free MRI review done. That's sitting at your home. You literally go over your MRI of your back with me. I'm going to verify the diagnosis is the SI joint or whatever else it could be. We're going to figure it out together. By the end of that session, I will be able to tell you, okay, it's your SI joint, or it's your piriformis, or it's your disc, or your coccyx, or whatever it could be, okay? And then once we know the cause of your pain, then we can give you a recommended treatment for it. All right, that's good. We're done with the right SI joint. And SI joint fusion, I don't recommend anymore. We used to do it, but problem is it didn't help the patients. Sure, you make money doing it as a surgeon. The surgery center made a lot of money. The hospital makes money. The companies that make those implants, they make money too. Everybody gets rich on those SI joint fusions, except the patients suffer because it's a very invasive surgery. It's extremely traumatic. You're putting a giant bolt across the SI joint, or 2 or 3. And the reality is these surgeons try to pack in as many bolts as they can. Usually they go for 3. And they say, oh yeah, biomechanically it's more stable. Nonsense. Financially it's more stable for them. That's why they do it. You don't need 3 bolts, you don't need 2, and you don't need 1. You don't need SI fusion at all. There was a study out of Norway last year on SI joint fusion that proved patients who had SI joint fusion did no better than patients who had medication. So basically, the SI joint fusion didn't work. Yeah, but it's being promoted heavily by companies that make the bolts, right? Because after all, that's where they make their money. But it's not good for patients. All right. So what we've been doing is this RHIZOTOMY here that you're watching right now. And what I do is I use this little probe shot, and Jordan, show them the SI joint. Take a look at this SI joint. There's the bottom right there, and then we go up, up, up to the top of the joint right there. The SI joint is a joint between the sacrum, show them the sacrum, yes, and the iliac bone or hip bone right there. Okay? It's not the femur, but the hip bone. That joint is full of arthritis. You see the black coloration there? The dark stuff, that's called sclerosis. You see this widening of the joint? That's joint effusion. That's because he has arthritis in the joint. It's really hurting him. And what hurts is the tear in the capsule of the joint. But there are 5 nerves. They run right from the spine and the holes in the tailbone, and they run right on over to the SI joint to innervate it. So if I can go in and destroy those 5 nerves, which I'm doing with our Deuk plasma rhizotomy, then the patient won't have any more pain. And that's what I'm hoping we can do for this gentleman. Any other questions, Sean?
No current questions, so we do have a comment from Steve once more on YouTube saying, I can't have an MRI due to a spinal cord stimulator.
Sure. Okay, Steve, just get a CAT scan. Just get a CAT scan, my friend. If you have a CAT scan, bring your CAT scan to the meeting, and I'll do your meeting on a CAT scan. Sean? Okay, that's all we need, my friend. CAT scan. If you don't have a CAT scan, shoot, try to get one done, because I got to have something to look at. But yes, we can definitely 100%. If you're having back pain, we can help you. We can fix it. That's what we do. Any other questions?
At this moment, no current questions.
Woohoo! I know. I'm kidding. So I'm just showing you we wasted it. All right? Oh, shit. But that's okay. No, we'll do whatever's left, if there's a little bit left. Yeah, I guess so. All right, folks, we're done with the SI joints. I hope you enjoyed it. For those of you who have pain, please come to our website, deukspine.com, fill out the brief form, submit your MRI or CAT scan. Let me figure out what's wrong with you. We got a great team. In 10 minutes, we'll tell you exactly what's wrong and how to fix it. Thanks for joining us. We'll be back with a left piriformis